again, Facebook friends of North Mitcham Clinic. So we've been loving the response we had to our little Facebook videos so far, so we thought we'd expand them into some more educational videos on topics that are relevant to you guys. So the first topic I thought we'd start off with is the new cervical cancer screening program. On December 1st, 2017, the old pap smear was replaced with a new cervical screening test. You might have heard on the media recently that Australia is actually on track to become the first country in the world to eradicate cervical cancer, and that's due to happen in the next 40 years. It's pretty incredible stuff, and we owe it all to the HPV vaccine called Gardasil and Australia's world-class screening program. But what does this new program actually mean for you? So on the old pap smear system, we basically visualise the cervix and take a sample of some cells. These cells would then be put on a slide and get sent to a lab, where someone would have a look down a microscope to check if they were becoming cancerous or precancerous. What we now know though, is that these changes actually come about because of the human papillomavirus, or HPV. So now we actually have the technology to go in and look directly for the virus, even before it has a chance to make those changes. So as a result, the whole system is a lot more effective and can pick up potential issues earlier on. Now what that actually means for you guys is that if you're having a negative or normal test result, you only need screening once every 5 years as opposed to once every 2. And I think that's something that every woman is rejoicing about. Now remember, you still need to get regular cervical cancer screening done, even if you've had the HPV vaccine called Gardasil. That's because the vaccine doesn't cover all the different types of HPV that can cause cervical cancer. In Australia, 800 women every year are still diagnosed with cervical cancer, and 250 will die from it. But we know that 80% of these women who are diagnosed with cervical cancer have not been getting their regular cervical cancer screening tests done. Cervical cancer is preventable. When we pick up the changes early, we have treatments that are very effective. We're expecting the new test to save 30% more lives than the old pap smear test. So if you're aged between 25 and 74 and are due for your next cervical cancer screening test, have been putting it off for a while, or just want to get some more information about it, please book an appointment with one of your friendly GPs at North Mitcham Clinic. Together we'll do everything we can in our fight against cervical cancer. So I hope you enjoyed that little video about cervical cancer screening. If you have any more topics that you think you'd like us to cover online, please leave them in the comments.